Hi, everybody. My name is Leslie Weidenbetter, and I'm the managing editor at IBJ. Thank you so much, everybody, for being here. I was actually the moderator for the first panel we did in this partnership with Gleaners, and I am really thrilled to be back. We have a great panel. I'm going to introduce everybody, and then we're going to jump right in so that we have lots of time today to discuss these issues. So I'm going to start down here on my left, your right. We have Chris Lowery. Chris is the Senior Vice President for Workforce Alignment at Ivy Tech Community College. And Chris is a board member for Gleaners. Next, we have Alan Gilbert, Vice President of New Business Initiatives at Anthem. And Alan is actually new to Anthem, a few months, new to the Indianapolis area, and we are very excited to have him here today. Sarah Huber is the Nutrition Manager at Gleaners Food Bank. Dr. Lisa Harris is the CEO of Eskenazi Hospital. And Joe Hansen is Executive Vice President of Strategic Initiatives for the Indianapolis Neighborhood Housing Partnership. So thank you guys so much for being here. Our theme today is time for creative intervention. And there are, of course, many examples, including a few that have come about since IBJ and Gleaners first began partnering on this event. I'd like to start with one of the newest ones. Alan, tell us, we're throwing you right into the fire here. Alan, tell us about Anthem Foundation's partnership with Feeding America to launch the Food is Medicine program, and why did Anthem make food insecurity a priority?
Thanks, Leslie. And thank you, IBJ and Gleaners, for doing this great event. It's a great jumping into the fire, as you say, as the new guy in the city. Anthem's been in this city for 75 years, and in Indiana, and it's a very exciting opportunity to really think about why Anthem should be involved. And we're not just an insurer that covers 40 million lives in the country, but we're also an employer in the community that has over 70,000 employees in this country. So we look at it in both ways, and we think about it in terms of what's good for our associates and our employees and their families, but also what's good for our members, those 40 million lives. And so when you think about insurers and you think about the members that are out there, that people might have food insecurity, they're not thinking about their health if they're thinking about feeding their family, or they're hungry for the day, or they have other social issues. And so these have direct consequences for our members in terms of, and I know John mentioned this earlier, in terms of hypertension and other health consequences. So it's in our economic interest and to work on these issues in the community. So our Food is Medicine initiative is in line with all of those priorities. And so we're really simply partnering in this community, but also 7 others with Feeding America to really tackle these issues. And really simply just asking, with the clinicians, asking them simple questions and screening assessments, whether or not they have social issues that impede their taking care of themselves, like food or other issues. And then from there, we're able to provide the necessary interventions. It could be food, it could be transportation, but we're looking at those issues.
Dr. Harris, Eskenazi is a partner in the program. Where is the Food is Medicine program in place in the system, and how is it working so far?
Thank you, Leslie, and again, also thank you, the IBJ. We're very happy to be having this conversation this morning, and welcome to Indianapolis.
Thank
Alan.
you.
We're also thrilled that Anthem is taking this step because, as John said, food insecurity is at the heart of the vast majority of the chronic disease that burdens our patients and our community. The Food is Medicine program has allowed us to build on ongoing work at our Picard Health Center on the northwest side of Indianapolis. Deanna Rianoso, who leads this work at that center, is here this morning. This is work that we started in 2015 in partnership with Gleaners, and Sarah has been a big advocate and support us in doing this specifically. But we were in partnership with Gleaners, with Corteva Agri-Sciences, St. Luke's United Methodist Church, and in 2015 we opened a food pantry. And then we established a farm on the grounds of the health center that annually provides over 11,000 pounds of produce to that pantry. So prior to establishing this program, we'd created the capacity for our healthcare providers at Picard to screen their patients for food insecurity, but not surprisingly, it wasn't until we created the opportunity for them to actually be able to do something about it, meaning writing a prescription that patients fill with bags of food at the pantry, that they actually began to screen patients in earnest. And also, not surprisingly, we found that a large proportion of our patients are food insecure. So we've grown from serving about 15,000 individuals the first year to being on track to serve over 65,000 this year through the pantry. And the Food as Medicine program through Anthem is allowing us to enhance this work by increasing the availability of fresh produce and the nutritive value of the food that we offer. We've also, through this grant, we have added group visits, groups for kids and their families, and other groups for adults with chronic diseases that take place right within the pantry. And the physicians help lead these group visits. They're also there to attend to any medical needs that the patients might have so that we can bring the greatest value to this time that patients are investing, because we want to be the one place where things get easier, not harder. The groups each have 12 to 15 patients. They're offered through the period of the grant as 8-week sessions, and we're going to be looking at healthcare outcomes as well as changes in health beliefs and health practices as a result of this work to see the impact of these added resources.
Sarah, can you talk a little bit about why this kind of a partnership was important for Gleaners and how it might be an example of other things that you can work on?
Absolutely. This Food as Medicine project made a lot of sense for us at Gleaners because we've been increasing our focus on collaborative ways to both address food insecurity and chronic disease in our communities. And we had a very obvious and strong key partnership already in place with the Eskenazi Health Center Picard and Crooked Creek Food Pantry. So we saw this as an opportunity to really strengthen that partnership and improve our outputs through the pantry and just our services to those patients at the clinic. But in talking to Dr. Reynoso and other staff members at the clinic, we learned that kids are coming in with prediabetes, obesity, even fatty liver disease because they don't have access to nutritious foods. And I personally am a firm believer that food insecurity and poverty do not need to be a life sentence for chronic disease or poor health. We have the tools and the resources to prevent these problems and solve them together. So we were really excited about the doors that this grant has been opening for us. And as Dr. Harris mentioned, we've just really been able to dive into best practices of food insecurity screening and providing those on-site food assistance resources. And also just learning from the other food banks that are participating in this grant. And it's also opened some neat doors to provide education to medical students and residents in training them on why is food insecurity important to look at in your patients, and how can you as a provider be empowered to make a difference in that area.
So this question could really be for Sarah, Allen, or Dr. Harris. Dr. Harris, you did mention that there will be some tracking. What are the steps that you all are taking to get a sense of how well this kind of program is working, and then whether it should be expanded?
Well, again, the biometric measures we're looking at are for patients with prediabetes, seeing if we reduce their A1C. For patients with diabetes, seeing that we also improve their glycemic control. Blood pressure, there are many measures that we can use to see if we are actually having an impact. Weight, obviously, BMI. So those are the hard outcomes. Those take a while to achieve. So we look at process measures too, the things that we know that if we achieve those over time, some of those harder outcomes will be achieved, and that's certainly looking at weight, looking at people's attitudes toward health and health behaviors, looking at eating habits. Have people changed their behaviors in terms of the percentage of real food compared to processed food, sugary drinks, that sort of thing.
Alan, you guys are doing this across several communities. How are you going about tracking to find out what the outcomes are?
Yeah, absolutely. And so what she described is exactly right. And what's extraordinary about this program is that you would think that we were doing these, that all insurers and all providers were doing these kind of tracking to see if we can make improvements on outcome, but we're not doing the job that we need to be doing. And so what's exciting about the kinds of programs like this and the ones that we're doing in 6 other communities, in Atlanta and Richmond and Nashville, Cincinnati and Louisville, and here, is that we are able to track all of these health indicators and then look at their things in 6 months, for example, and bump that against claims data and say, they are actually improving their outcomes, right? And they're not being readmitted to the hospital, or they're not in the ER as much as they were before. And of course, as a business, I always talk about my 2 hats. As a business, that means these folks are employees that they're probably more productive at your office. They're probably not off from work as often because so worker productivity goes up. These are all ROIs for businesses to be thinking about as they think about why they should get involved in these issues as well. But it's just extraordinary the work that we're doing and the learnings, I'm sure. Sarah mentioned earlier that she's talking to these other programs, and we're really having that collaborative work together to really understand, and nothing like 7 communities, right? To be able to say, I'm running up against this problem, how have you handled it? And so we're really tracking it in that way too. And we are doing programs across the country. This is a test of whether we can, in our other places and plans, actually roll out these kind of activities for all of our members. And that's a lot, 40 million across the country.
So part of the reason that programs like Food is Medicine are so important is that research shows that when people are hungry or worried about their next meal or are skipping meals, everything else in their lives is impacted. Their health, their sleep, their concentration, their ability to work or study. A recent study by Temple University and the Wisconsin Hope Lab found that more than 1/3 of college students had experienced food insecurity in the 30 days prior to the study. Chris, Ivy Tech is taking steps to attack this program. Last year, it partnered with Gleaners to open the Hamilton County Cupboard at your campus in Noblesville. How does the program work, and what is the overall goal?
Yeah, Leslie, thank you. And also, again, thank you to IBJ and John, to you and your team at Gleaners for bringing this together. And I'll say, to start this, that it represents what's going on in this room today. I've talked with a number of friends here today who come from different facets, who have expertise in different areas. And to me, what's happening at Noblesville with the food pantry there, sponsored by Gleaners, is really a recognition of this intersection of specialty, capability, and expertise. So we have a food pantry at the Noblesville Ivy Tech site, and it's there to serve our students. We have 2,700 students as of last year at our Noblesville campus or site. And that site provides food to our students and certainly others who walk in, and it's hundreds. So I think that's a recognition in and of itself that perhaps all of us think about Hamilton County as a place where hunger doesn't exist. Or maybe if it does, it's at a small scale. It's not. Hunger exists across our state and is represented there. It's certainly represented with our students. Many of you probably know our students face a number of challenges. We've heard some of those today, but from food insecurity to transportation to homelessness, those are our students. So this kind of partnership, we believe, really leverages the best of what can exist. And again, Noblesville is sort of a microcosm for us because we have Gleaners there, also distributing, by the way, federal commodities, which some of the other food pantries in the area don't do, so that's sort of an extra plus. But then we also have folks from Kent Kramer's organization with the Excel Center there. And we have Adult Basic Ed. And we have the Department of Workforce Development's Work One office. And the reason we do is that Sue Elsterman and I realize we can't do those things alone as a college. And in those examples, if you think about it, I listed really 4, I think, organizations there. We're trying to get to the realization that 1 + 1 + 1 + 1 ought to equal something more like 5. Right? And that when folks have talked about collaborative, John used the word, I think, interconnectedness. We can't do this alone. The outcomes will be better. And, some of the outcomes we're looking at, certainly looking at leading indicators, can we help our students not experience hunger? And then longitudinally, what those outcomes look like. And we're starting to measure them, in fact, in terms of careers, placement, and wages.
Chris, do you think there will be a time when you expand that program to other campuses?
Absolutely. And we're starting to see it in different variations, and we think it ought to fit for what a community does. The Indianapolis campus just up the street here has a food pantry, and I know John's going to be there for a little event next week. We have another campus where folks on the ground have brought together a really interesting idea to feed school-age children during the summer. And it's a combination of a local pantry being supplied by Gleaners at an Ivy Tech campus with a local ministerial association, all coming together to say, these kids need food in the summer. So, long answer to the question, Leslie, but yes, we're already starting to see that establish itself, ways that are good for each community.
Sarah, what is Gleaners learning from these kinds of programs, and how are you looking at expanding them to other areas, other schools even?
Mm-hmm. I agree with everything Chris said. He talked about that co-location of services in already existing community hubs. So schools are a really obvious choice for those because people are coming there to get education, even elementary or high schools where families are coming, picking up, dropping off their kids, coming to sporting events. If we can provide services like food pantries or SNAP outreach at the places they're already going, we can help address other needs beyond education, and we can make that very easy for people who might experience transportation concerns. So as Gleaners is moving forward with our strategic plan and looking at more of a regional approach to our hunger relief, we're hoping to learn more about the unique needs of each community. So looking at this county, what are the needs that exist, and maybe what are some anchor institutions that we can identify as being those community hubs where we can co-locate those services. So maybe that's a college campus, maybe that's a school, maybe it's an existing food pantry. We're gonna make that unique to each community.
And Sarah, do you find that most other organizations, those anchor institutions that you're talking about, do they immediately recognize the potential there, or do you need to talk to them about hunger and how that is interconnected with so many things?
It varies quite a bit, but once you let people know that hunger exists in their community, I've found that most people are ready to jump on board. I think it's easy to identify with not being able to provide food on your table. That's pretty heartbreaking to realize that a lot of our neighbors are experiencing this. So we've had really wonderful partners just jump right on board, including everyone here at this table.
Can I just jump in a second, just on the community and the college issue? I think this is a really important area that we're exploring at Anthem. Our foundation has partnered in Virginia, for example, to work with community colleges, which are particularly hard hit. And so we have a program that we're exploring in that state where we're working with 11 community colleges to better understand their needs. You don't really think about hunger on a college campus. Mm-hmm. But there's also, I think John mentioned earlier, about waste. College campuses have a lot of food waste, and there are creative programs across the country that are sort of dealing with that waste by pushing those meals, that food they have left over, into the community at the end of the day or during the day. And there's some just incredible things that are going on. So I think this is another area. Anthem actually sells insurance in the college markets, and so there's that opportunity, Lisa, to really sort of work with a cohort of individuals and sort of really see and track, which is my sort of big issue. I always want to track to see that we're actually making change happen and it's sustainable.
The interconnectedness issue, of course, is really important, and that is why Joe's here. When you think about a hunger and health event, you might not immediately think that there would be a panelist from the representing the housing community, but I think INHP has discovered that this is part of a larger issue of folks struggling. How are you seeing these issues interconnected?
Well, good morning, and thank you for that question. And yes, it would seem odd on the surface to have a housing organization at a hunger panel, but it is that interconnectedness that it's so important for us to explore. So first I want to start with the data as we look at it to add to some of the comments that John had to open. And first, some data that we had pulled together, some research done by Green Street, indicated that 124,000 households in Marion County are both low and moderate income and housing cost burden. That means they're spending more than 30% of their income on housing alone. Those families are at risk of a life event having an outsized impact on their ability to meet other obligations, including healthcare, food, education, and even just cultural amenities and activities. And so as we look at the interconnectedness, we see that if they're spending 30% on housing, they're at greater risk. So we have tools that we try to deploy in recognition of the interconnectedness of poverty and all the implications it has on the household. Tools to help people access mortgages affordably, thereby reducing that housing cost. Tools to help with deferred maintenance on their home, those surprises, those life events that may trigger other implications such as food insecurity. And importantly, we also have tools to increase the supply of affordable housing. And there I want to focus just a second on, it's not good enough to increase the supply of affordable housing if you're not also thinking about where that affordable housing is. Access not just to food, but access to transportation, so they have access to jobs and access to health care and access to food, or access to their employer. And we've talked a little bit about anchor institutions, so encouraging employees to live close to where they work is another opportunity to explore. So that is the interconnectedness by the way we see it.
I want you to actually spend a few minutes talking about, in terms of interconnectedness, the way you are working with employers in your partnership with Indy Chamber to help people live near their work and to acquire a home more affordably, so that a lot of these big issues don't happen. Can you talk about that program?
Absolutely, happy to. This is a program led by the Indy Chamber. It has three aspects to it, and we're going to talk just about the housing component of it. And the program is called Anchoring Revitalization. And so it's about the anchor institutions investing in their employees and their neighborhood to revitalize the area directly around their employment centers. And Eskenazi Health and Hospital Corporation are two of the anchor institutions participating in this program. And it has a couple of specific aspects. The first is, as kind of referenced before, helping their employees live close to where they work. And the way they do that is provide down payment assistance for their employees. And through the generosity of the Lilly Endowment, INHP is able to match those resources. So a couple of anchors are offering as much as $15,000 of down payment assistance to their employee. We're able to match that. And the outcome is a much more affordable mortgage for that employee to live close to where they work. So think about it again, we're addressing safe, decent, affordable housing in close proximity to their employment. And so we've addressed a couple of the leading costs in a household.
Have you found that employers is this something they're eager to do? Do they understand the sort of issues that a lot of their employees are having, or do you kind of have to bring them along?
They've been eager. In fact, they had to apply to participate in the program, so the sheer fact that they applied is an expression of their interest in participating in that. But they also like INHP. So this was a pilot program. We had not had an anchor strategy in Indianapolis previously, so we were learning, and the anchors were willing participants to come alongside us and see what came of this initiative. And some of the anchors, I think, were surprised at the number of employees that couldn't qualify for a mortgage. Their credit was in such a position that they were not only housing cost burden in their current situation, but they were burdened with other debts, including student loan and the like. And so they were, I think, surprised as a group by the number of financial challenges that their employees were faced. And they responded in different ways. Some anchors asked us to do our education, our understanding credit, dollars and cents, basic home finance and budgeting, even our home buyer education classes on site to make it even more accessible to their employees. Others added us to their employee assistance program so that when life happened and housing instability was at risk, which meant everything else in their life was at risk, that they had access to a resource that could help them through that process.
I think we find employers are often surprised. For example, a family of 4 with gross income of less than $32,000 qualifies for SNAP benefits, but the median household income in Marion County is only about $45,000. So clearly there will be a lot of people who fall under that SNAP level. Sarah, what are other ways for employers to participate in tackling food insecurity and other poverty problems or just low income problems associated with it?
I think it starts with what you just mentioned, Leslie, in looking at the wages that employers are paying their employees. I encourage employers to compare those to the federal assistance guidelines, such as SNAP or WIC, and see how those compare. Are you paying your employees a livable wage? That's step one, and to make changes if you see any discrepancies there. Step 2 would be to just get feedback from your employees and see maybe what they're struggling with, what they could use assistance with or further education on, and make changes that way. And another thing I think is very important is looking at the holistic health of employees. Alan had mentioned when all your needs are taken care of, you can be a much more productive employee. So looking at what are those underlying needs that maybe are happening outside of the workplace, how can you impact those? And also make the workplace a more enjoyable environment. I know at Gleaners we've been really focused on wellness initiatives, so we have a great employee wellness committee, and we do a lot of different fun challenges just to get people thinking about their health and how they can take that home and impact their families to reduce healthcare costs, which plays into that whole cycle of poverty and food insecurity. And also just providing competitive benefit packages. I know Gleaners has been focused on that, as well as providing educational opportunities. So bringing in speakers to talk about financial health, or sending employees to leadership conferences so that staff can be empowered to be the best staff that they can be. And lastly, as Joe mentioned, just informing employees about available resources. So employee assistance programs, let staff know, hey, there's a website available for you with free resources. We advocate for 211 quite a bit, so that's a number you can call or a website you can use, just stocked full of resources on anything you can imagine based on your zip code. So it's nice that our staff are pretty aware of that because we use the cards quite a bit out in the community, but that's something that any employer could utilize.
Dr. Harris, I believe Eskenazi has looked at this issue within its own employees. What have you found?
Well, we have, and I would say, everything that we do to promote health starts with our own employees. So everything we're thinking about for our community, we think about within our workforce. And so we have applied these estimates, and it's, the SNAP eligibility is income and household size, so you have to do a little triangulation, but we would estimate that as we have worked to increase the wages for our low income or our entry level employees, we obviously employ a large number of individuals in food services and environmental services. At this point, we are at a minimum of $13 an hour for our entry-level employees, and we're working as, I know we all are across the community, to increase that. So at this point, we would estimate that maybe there's 50 to 80 individuals within our workforce at Eskenazi who actually would apply or would be eligible for SNAP benefits. I want also to shout out the Anchor Housing Program. We were thrilled about the opportunity, and then when we saw how many of our employees within Eskenazi, about 460, and then at Health and Hospital another 150, that's over 600 individuals immediately working to avail themselves of that opportunity. And appreciate also your flexibility, because we know as we work together and really understanding what the barriers are, what the challenges are, we saw increased participation, so that we're really using all those funds that are available.
We've needed that back and
yeah.
forth. We've needed to learn from you, and you've helped us a lot. Thank you.
And so in both, that's both mortgage assistance and home repairs. So even as we work to achieve the living wage and we work to secure housing, we know that there are many of our workers who still live in communities where they have inadequate access to healthful food. So we work to provide opportunities within the workplace. Now, many of our employees use our health system for their care, so they participate in the programs we've talked about. The program at Bicar is obviously the flagship of work we're doing across all of our community health centers, but we have a program, a free personalized health coaching program that is geared toward helping people prevent, better manage, and even reverse chronic disease. We have 27,000 visits to that. So our employees have access to these programs, but we also work within the workplace itself to make the healthful choices the easy choices. And so to make healthful food, for example, available to everyone with price points that are affordable. The food, increasingly, a focus we have is on the importance. It's not just calories, it's about nutrition. So the food that we serve throughout the facilities to our patients, and also through the retail areas to our employees and visitors, now is sourced over 60% from Indiana growers and producers to increase the value of the food we're serving. And we don't charge by weight at the salad bar. If you can cram it in there, it's yours, and we encourage that. And I'm as good at that as anybody.
I think that's going to make us all want to stop by for lunch.
You're welcome. So we have, again, for employees specifically, we have Fresh Veggie Fridays, where we offer free produce off of our Sky Farm, along with education and recipes for how to produce or how to prepare fresh produce. We have a Fresh For You market on the hospital campus, where we provide, again, fresh produce along with basic ingredients, some ready to assemble meals, and even cooking utensils. But for those who just don't have time to cook at all, we have a grab and go where they can pick up a nutritious, already prepared family-sized meal on their way out the door. So I think it really is about everything we can do to make the healthful choices easy and affordable. And so we are starting from within as we do that.
Lisa, you, as a hospital, you have some, I think, unique opportunities. You've already got a cafeteria or you've got a food service, you're serving patients, you're serving a larger group, but you guys are doing really innovative things. Do you all, any of you, have advice for other employers about how to incorporate maybe some of these things into their own programs for their employees?
Again, I think it's about thinking within your own environment, everything that you can do. So there may be, within our health centers, we've figured out ways to bring fresh food in even to the health centers, and these obviously don't have the full service kitchens that we have within the hospital. I think looking around and understanding what the local businesses are in your community, supporting those and encouraging. I think our example of food procurement is one where we see that it's starting to have a broader effect. So we recognize that in organizations across our community, we value we value good food. The challenge is, and we value supporting local farmers. The challenge is finding getting a reliable loop of supply, and demand. And so we've worked to create that in our world, so that it can be replicated. And we're starting to see, we've actually had inquiries from a number of large organizations across our community and the state coming to see what we've done and reproduce it. And so we are, that's the goal, is to really have this be much more pervasive.
Can I just say, these last few mile efficiencies are really important when it comes to thinking about these issues, but I just emphasize something we said earlier. I think it's like, survey your employees and find out what they're thinking, what their concerns are and what their needs are. we have 70,000 employees across the country, and in some of the states that have some of the highest food insecurity in the country. The USDA just put out new numbers in the last couple of weeks, right? And so food insecurity is improving across the country, according to the numbers I saw a couple of days ago. But Indiana is still one of the handful of states, for example, that statistically significantly higher rates of food insecurity. So we still have a lot of work to do. And so we have a lot of employees in Indiana and a lot of employees in these other places. And so, yes, we have looked at our own employees and asked them what their concerns are, and we're looking at all these kinds of strategies. We have cafeterias in a lot of our call centers and facilities around the corner from here. We have cafeterias. And yes, we've looked at what we're serving, right? Like, if we take away the hamburgers and tater tots, we might have a revolt. But we're trying to encourage, healthy foods, and we have some of the same kind of grab and go activities. But thinking about new creative ways to work on food in this community, I think, can go a long way. We're also, those 70,000 employees are also on Anthem Insurance, so they're members of ours, and so we can do that same kind of hard work we're doing in our program that we're doing with Gleaners and with Lisa on trying to figure out and track outcomes and see if those are improvements. So I think all of those things, I say all of the above, but first, ask.
I'd love to chime in on the subject of revolt, to call out Seth Grant here, who leads our food and nutrition services. When we moved to our new campus, we decided to leave the deep fryers behind, and that was a bit of a revolt. But that has to do with working with your employees. We made the point that we're not telling people our employees you can't eat fried food, but as a health system, we're not going to serve it. Every now and then that comes up again. We had when we ask, what would make life best in the emergency department, it's like they want the fried chicken tenders back. So,
Exactly.
So Seth, but there's a point here because it's about
It's probably the
working-
doctors that want it too, right?
Yeah, but it's a commitment. It's a commitment, and we have the benefit of having always cooked our own food. So that gives us a lot of flexibility because we can decide we're not working with a third-party vendor for that. But somebody like Seth can hold the line, and actually what we ended up doing is having a taste test. So we cook up a batch of chicken tenders, take it down to the emergency department, and work with them until we got it. You're right. They weren't fried, but they tasted better. And the funniest one was an email we got where someone, using all the language of food critics, the mouthfeel and one of our ED docs actually sent an email. So, but it really is getting engaged with employees, letting them know that you are really serious about this. You care about it, and we can make good food taste good, and we can make it good, nutritious food available at prices everybody can afford. But when you start really thinking about this, you'll find a lot of opportunity, and I'll tell you, it can become
You're really hitting on the issue, which is it's a culture change, right? I mean, today, if you walked into a building in this city and somebody was smoking in the lobby, you'd probably call the security guard over to throw them out. And so, but think about it. I mean, I've in past lives, I've traveled all over the world. If you walk into a courthouse or a hospital in China, there are smokers everywhere. They're smoking in the intensive care unit. So I mean, this is a culture change.
We used to do that.
And so you have to. It takes time. This is a long game, and we really have to work hard on it.
Dr. Harris, I think you might be able to create a new revenue stream by selling your recipe for.
Actually, the other
for
part about
yummy,
this
healthy
is
tenders.
our food services now are a revenue generator, and we are gathering. People are coming from way beyond the confines of our health center to eat at Eskenazi Health. So that's something that obviously redounds to the work we do as well.
I've been quite neglectful for not mentioning that if you have questions, you can write them on the pad of paper that is on your table and wave them around and someone will swing by. You can also tweet a question with #health&hunger. So Alan, you mentioned that at Anthem you've been surveying folks. Have you found that even in your own system you have people whose income qualifies them for public assistance?
So we're still working on the survey, so I don't have any hard data yet, and we're looking at the strategies that we're going to deploy around it. But I guess what I'd say is if you look at our makeup of our employee population across the country, 70,000. And if you're sitting in a community that has, the kind of food insecurity numbers you have, say, in this one or others, you would expect, just like any of you would as employers, that you're going to have a percentage of your population with these issues. And so, yes, we've done the survey, and we're looking at the ways that we can, turn the dials and work on helping those most in need.
Leslie, I would add to that too. We find something to be really sort of illuminating with employers. We have a lot of employer partnerships, some represented today here, Ivy Tech does. We have a number of programs where, in working with the employer, we're helping to skill up current employees, right? Folks are at the place of employment. Frankly, that's a fairly easy place to find students. What's often surprising to employers is when we ask them to allow us to look for financial aid for their employees, that indeed a number of their employees qualify for financial aid, including Pell. So that's kind of eye-opening in that instance. But I think some of the things that have been said here, and you asked a question about how do we engage more employers to think in this way. We can just start with the pure business terms, and Alan referred to really measuring and having metrics around these things. Employers every day with their external customers do voice of the customer. I mean, that's a serious methodology at which probably many of you in the room are really good. So voice of the customer, including the internal customer, and then also measuring, right? We know there are increased levels of productivity, reductions in things like lost work days and so forth if folks aren't hungry, if they are healthier, and if they have good housing. So those things are truly measurable, and I think whether it's doing the right thing or appealing to the business side of what an employer is doing, this just makes sense to be finding those kinds of partners and doing this kind of work.
Chris, I was thinking about, you were talking about Noblesville and the problems that you don't think about that area, Hamilton County, as a place where there could be problems with food insecurity, but the suburban townships have actually seen poverty skyrocket. Mm-hmm. Are services in those areas keeping up with the needs? Yeah,
we have so many good partners. I chair the partnership committee for our board of directors at Gleaners, and the partners are doing their best to keep up, and we're constantly looking for partners, also working with our partners at food banks food pantries and local sort of installations to help them be even more effective and efficient. John referred to the 40% improvement, sort of the throughput over the past year. Those are the types of things we're trying to help our partners who, they're part of the coalition of the willing, and we're trying to help them be more effective and then, gain partners in the process.
Can I just say, I think the key point here is partnerships and collaboration across sectors. So everybody in this room, if you're not in health, you may think, I don't need to worry about this, but look at this cross sector at this table. I know of projects in other cities where they've been able to relocate food pantries basically in high need areas, hiding in plain sight, in places, like you said, Leslie, that you don't normally think of. And that's because the cross-sector partnerships did things like survey the employees, work with the health systems to overlay sort of data to understand where you may have needs that you're not really addressing. And so it's really important, these cross-sector partnerships that you have in communities like Indianapolis, to work on these issues.
And I'm just going to add a quick one to that. Yeah, there's been some great research and writing done in the past few years on this intersection and really blurriness between relief, opportunity, and transformation. I think to a great degree we think of Gleaners being in the relief side of it. But as you've probably heard John say several times, we are feeding the line and we're reducing the line. Right, and that starts to blur things. And as a community college, we think we're in the business of opportunity, to help people see that transformation. But it has to be blurry because one just doesn't work as well as it could without the other.
We have a question from the audience that I think is really interesting and ties into this collaboration issue. And it's actually about San Antonio. It says has successfully established a kind of college-like campus coupled with aggressive panhandling laws to feed, house, and counsel some hundreds of maybe thousands of homeless who are food challenged and struggling with housing. How can Indianapolis combine some of these things that you're talking about with housing and food insecurity and health and address some of the issues with homelessness that we seem to be struggling with?
you don't mind, I'm going to jump in on that one. I had the pleasure of going on the Indy Chamber Leadership Exchange to San Antonio, just got back last night, and that was one of the most eye-opening tours that we had. The entity is called Haven for Hope, and it was San Antonio's response to homelessness, and it really is multifaceted. It's unprecedented in scale, at least in terms of what I have seen in my limited experience. There are 1,700 residents living in 22 acres that the city of San Antonio has set aside that provides comprehensive services to its residents. And it's set up to meet the resident where they are. They have outdoor courtyard space along the Housing First model for residents that are simply not ready yet to try to break their drug or alcohol habits. And so that's just a safe place for them to sleep. Then they have 19 service providers co-located in this to help them connect with food, connect with housing, any number of social services that might be needed, even assistance reestablishing their identity. So many homeless have lost their IDs. And so that one place, Haven for Hope, and you can look it up and you can donate to them, but that one place is, I think, an example nationally of what we're talking about here, and recognizing the interconnectedness of all of the issues, mental, food, housing, you name it. And they're addressing it in a unique way.
One of the interesting things is all of these issues that we're talking about, all of the concerns, even among those who are employed, are happening at a time when our economy is pretty strong. We're starting to see signs that a downturn may be coming, and of course we know that the economy is cyclical. A downturn will be coming. How do you envision that an economic downturn could impact the city right now in terms of these hunger, health, and housing issues?
I'll stab at that one. And it does relate to education. You might expect I would say something about that. Whether it's Indianapolis or whether it's the state, we face a challenge in Indiana. Recent studies have said we have a working population at as high a risk of any state in the nation as we think about digitization and automation. And that's because folks need more and better skills to get the kind of jobs, right, that affect all of these other things in the process. You know, Indiana has 1.2 million Hoosier working age adults with a high school diploma only, 500,000 to 600,000 with no high school diploma. And where we start to see that is as a recession comes, right, these are economic cycles. Those who are least prepared to stay in the economy are going to suffer the most. There are studies, and many of you have seen them, whether it's all the way back to 1980, whether it's back to 90 or back to 95, that show by educational attainment, any individual adjusted for inflation with a high school diploma or less has gone backwards. That's a reality, and that faces the ability to have a home and to not be hungry and to access good health care and to access higher education and so forth.
I just say that we are looking at the volumes of services that we provide, and we're not, I would say, reflected in the care people are seeking. I would not suggest that we think that we're in any necessarily improvement. I think we've got more jobs, but they're low-paying jobs. So we already, for example, we're seeing, record volumes across our health centers. 50% increase in primary care visits, 20% of patients are new. And after that first visit, 7 more visits after that within a period of a year to 18 months, which suggests a lot of pent-up demand that is probably we're able to address with the opportunity of Medicaid expansion under HIP 2.0. So people, I think there's been care that has gone unmet because people had no opportunity to seek care. They're seeking care now. So we're feeling a surge of pent-up demand, and thinking about now a downturn after that. We really are looking hard at how we're going to be able to meet the needs. And so that also brings this work on the front end, everything we're doing to focus on what we now widely appreciate as the social determinants of health, deciding it is our job, along with everything else, we're doing in healthcare, to meet immediate needs, the trauma, the immediate, end stage of chronic disease, that it's our job also to be working hard on the front end to try to have an impact on these factors that create the stage for poor health and health outcomes, and the expense, and that vicious circle that stems from that.
The only thing I would add is, because I associate myself with all these comments, is that I have to be a little bit hopeful, because 10 years ago or beyond, when we had the last recession in 2008, probably no one really even knew the term social determinants of health. And it's because of the kinds of sort of work in progress we've made and the cross-sector collaborations that we've talked about so much today, that I think we will be more prepared to deal with some of these issues. Yes, they will be hard. Yes, there will be surges that we'll need to deal with. But I think the country and our communities are more able and ready to handle these kind of issues because of the kinds of work we've done over the last decade. I'm hopeful.
Alan, I share your optimism, but a downturn scares me relative to the population we serve, and I'll use this illustration in particular. The median income in Marion County 5 years ago could afford the median home in Marion County, and today that's not the case, and that's not in a declining economy. It's a case where housing costs have been rising faster than incomes. So if you combine the fact of what we've seen over the last 5 years with the prospect of a downturn in the economy, which could have unfavorable implications on incomes for all the reasons we've just discussed, I think it's something to be alert to.
And we're even looking at we're looking at zip codes. We're mapping patients to zip codes and finding increasing rates of poverty within zip codes, within neighborhoods, and tying that directly toward increased need for services. So I think we're already in a downward spiral.
Sarah, are you feeling, at Gleaners, are you all working on thinking about what the next downturn might look like? And do you feel like you're prepared, and you and your partners are prepared to handle something like that?
I was going to piggyback off of what the panelists said already, that it increases the urgency of focusing on this need. Building these strong partnerships so that we can not only meet the need today, but meet the need tomorrow. As John said earlier, we still have a long way to go, and with an economic downturn, we have an even further way to go. So we really rely on our partnerships, on maximizing the efficiency of our team at Gleaners and the efficiency of our partners who are getting the food out to our hungry neighbors, but also promoting things like continuing education, stable housing, so that people can kind of take the blow a little easier when times do become hard, that they can get through those times with fewer consequences, I would say. So I think we are thinking of that, but just looking at, we're maximizing our resources as much as possible, no matter what the economy is going to do, so that we can be prepared.
So some of you know that I was a political reporter in a previous life, so I don't want to get too far away from that. And of course, we have a mayoral race this year, and food insecurity and poverty issues have been central to some of those discussions. Mayor Hogsett, who has joined us today, Mayor Hogsett has proposed $580,000 for programs that include transporting people to grocery stores via Lyft, a Food Compass smartphone app, a mobile grocery store, and what he calls neighborhood food champions. Republican Senator Jim Merritt, who is challenging him, has proposed tax incentives or subsidies for local food markets in areas with food insecurity, as well as the creation of a food tax increment financing district that would support communities. He also wants to create more community gardens. So I want to ask each of you to talk about what you think the candidates are getting right, where are they wrong, and what would you like to hear from them? And let's...
Should we put the mayor right up here in the front?
Let's start with Joe. Sorry to put you on the spot like that.
Thank you. So I'll start by pointing out that the Indianapolis Neighborhood Housing Partnership is a supporting organization to the city of Indianapolis. So we've had the opportunity to work with mayors of both parties. And in our experience, we have found the mayors to be very supportive of low and moderate income populations, particularly in the areas that we serve, down payment assistance, repair assistance. So we've been very appreciative of that longstanding support. But as it relates to food insecurity, first, very appreciative of the attention that poverty, including food insecurity, is receiving in the debates. And as long as we can discuss these matters, I think as a populace, we stand a better chance of moving the ball forward in productive ways. So some of the solutions, so my theme up here really has been around access. Through housing, you have access. Through transportation, you have access. And I think the solutions offered that you've outlined here by both of the candidates speak to access. In some cases, it's about bringing food to the people. In other cases, it's about bringing people to the food. Ultimately, I think both solutions are going to be necessary for individuals and for neighborhoods, depending on where they are and what their situation is.
Dr. Harris?
I'd say, first of all, we're encouraged in our work when those who lead show up. So thank you, Mayor Hogsett, for being here this morning. I see you at most, I can't think of an event where we're talking about something that matters that you weren't present. And so we thank you for that. We're also encouraged when those aspiring to lead focus on the issue of poverty. And it's the growing poverty problem in our community. This, of course, is a complex problem, but given the foundational importance of nutrition to the good health that's essential to everything that we aspire to individually and collectively, we're especially pleased that both candidates are focusing particularly on food insecurity. We encourage thought, a lot of not giving up and really focusing efforts on food quality. We think the problem is not largely one of access to calories, but access to nutrition. We need to focus on availability and affordability of nutrient-dense as opposed to nutrient-devoid food. We also, I think many in the room would be very enthusiastic about reducing redundancy and complexity by working to bring existing programs and resources together into a cohesive structure that makes things simpler, both for those seeking services and those providing them. For example, estimates suggest that about half of individuals who would be eligible for current food assistance programs are not enrolled. So that seems like a place to focus. And as health systems, we're working to see if we can adopt a common platform for identifying patients' needs and linking them to resources. So then finally, though we now know that we can even reverse established diseases such as diabetes and high blood pressure through changes in nutrition, it's a lot easier if we start earlier in life to prevent rather than to try to reverse chronic disease later on. And we know the importance of nutrition to the brain development and consequently to kids' ability to achieve the milestones in life that we know set them up for success. So for these reasons, we would encourage in particular efforts that are directed toward children.
Sarah, what would you like the candidates for mayor to know?
I absolutely want to echo what Joe and Dr. Harris have already said. What a blessing that we have a current leader and aspiring leaders who take the issue of food insecurity so seriously. Mayor Hogsett has just shown sincere commitment to this issue in our city, so we're very appreciative to him and the city of Indianapolis in general. So first of all, I think this is a great focus to continue moving forward with, and all of the proposed projects are really great starting points at looking at how can we solve this complex and widespread issue. I want to also add on to that, because it is so widespread and complex, it can't be solved just by the mayor's office or the city staff alone. It's a common theme, you've heard it over and over again today, but we are so focused on collaboration. None of us can do this by ourselves. So looking at continuing these community conversations and especially getting the voice of those most affected by food insecurity and those on the front lines of hunger relief. What are they seeing as needs and as solutions? I also want to add, let's look at resources that are already available and leverage those to their full capacity. I know we have some friends here from Marion County Public Health Department, so I just want to commend them for their work with Healthy Corner Store initiatives. They're looking at, hey, we've got corner stores, we've got convenience stores, let's bring healthy food to those already existing vendors. And they're also looking at maximizing SNAP recipients' dollars at community gardens and farmers markets through the Fresh Bucks program. So they're maximizing those resources that are already in neighborhoods, and I think that's a great model to take after and keep money in those local economies. And bouncing off of the SNAP comment I made, SNAP is so important to the clients that we serve. We could never meet the need if there were not federal programs such as SNAP. We have a SNAP outreach team at Gleaners dedicated to educating people about this program, helping them sign up for these benefits. And SNAP really is important. It's great if we have grocery stores in every neighborhood, but it's not beneficial to those residents if they can't afford the food there. So Feeding America puts out a SNAP impact calculator every year, and the most recent results show that for every $1 of SNAP benefits that are spent in a community, it can generate $1.54 in economic impact. So I think just advocating for a combination of both local and federal programs that bring people to food, bring food to people, and really bring the whole community together.
Alan, you're very new to the Indianapolis community, but do you have some thoughts on this question?
Exactly. I feel like Chris, you and I could just get to say ditto almost
Exactly.
in some ways. But
Yes,
so
yes, yes.
I'm moving here from Washington D.C., so I am sort of know a little bit about politics and have been around it a lot. And what I'd say is, when was the last time you heard food be a campaign issue anywhere, right? And to be really talked about. And so that's why I'm very inspired and feel like is extraordinary in this community in my short time here, that we're actually talking about this as an issue that is important and that is a campaign issue. So I applaud that and say, yes, right on, keep going. We even have like a former Indianapolis resident and HHS secretary who's also talking about these upstream issues and thinking about things like the SNAP dollars and working with his partners across other agencies. We are thinking about those things as well. I mean, we enroll 40 million lives, and there's got to be a way to connect the dots and be able to find out and help enroll folks that are eligible for SNAP, because as you guys have said, there's lots of individuals out there that are eligible for these programs that aren't enrolling, and so let's dig in and figure out why and help them get those benefits. And we have pilots and programs across the country and bright spots, as I call them, where we're sort of exploring these opportunities, and not just from the foundation that does incredible work at Anthem, but from a business side, right? Because this is an economic business side to try to improve these outcomes for our members. The last thing I'd say is, well, the very first thing I did, sort of my first activity when I outside in the public, was I attended a corner store work in the Far East Side, I guess in late July. And Mayor, you were there, rolling out a program that Anthem was partnering with Feeding America. That's actually one of several programs that our foundation is doing across the country that's really doing it. And not only was the mayor there, but there were actually a lot of politicians there, and they were all talking about this issue. So I think we just need more of that. And so that's what I would say at the state level, at the federal level, at the local community level, in your neighborhood, watch, in your neighborhoods, talk about these issues, because they are first and they're front and center in many families' lives.
Chris, you either have the hardest job or the easiest, if you want to say ditto.
Ditto. No, I will echo some of this. When we were corresponding, Leslie, about specifically this topic and the mayoral candidates, like the rest of the panelists, I was just delighted that this is a topic. I've been fortunate over 35 years to be in public policy, the private sector, now in higher education, and I've yet to see a perfect solution. But what I do see is when this interconnectedness occurs, it's much richer. And I guess, I don't know if it's a recommendation, and it's probably implicit in both of the suggestions of Mayor Hogsett and Senator Merritt, is that recognition of public, private, and philanthropic. And going back to something I said earlier, when those come together, there's just a richness, and I think each one of us can point to the instances where we see public, private, philanthropic, and those three end up equaling something like 4 or 5, because thoughtful people are together and saying, so your idea is interesting, I've got a little different twist on it here, and I think each one of those sectors brings sometimes some leverage to the discussion. Sometimes pushing others to think about their solution a little differently. But from the moment you initiated that sort of discussion with those of us on the panel, I was just delighted. Mayor, Senator Merritt, that we're talking about that and recognizing that it's a need. And as John said earlier, and I would remind everyone, Gleaners, which serves 21 counties, is only meeting 47% of the need that we estimate.
Well, thank you very much to everybody for participating today. We really appreciate it. Let's give our panel a round of applause. And I'd like to invite John Elliott back up for a few closing remarks.
Thank you. First, to all of you for being here. Mr. Mayor, thank you for joining us. And especially, thank you to a thought-provoking panel. I'm in this job every day, and I feel like I have sort of my hands on what's going on and so on, but I learned a great deal. I heard you affirm a great deal. This is very helpful for all of us, I think, to be here. And if you'll forgive the indulgence, Sarah, I know your parents are here too, and they would probably echo me, but I'm very proud of you. That doesn't mean I'm not about the rest of the panel, but allow me a little favoritism, please. So let me close quickly with a recap of our new strategic plan. So you know where we're headed, first of all, but if hypothetically you were to choose to dip your credit card into the dip jar on the way out, you would know what you're investing in. So in February, our board unanimously approved the most ambitious strategic plan in Gleaners history. And there's a lot wrapped up in that statement. In August, a multi-year budget, a very ambitious multi-year budget, for the first time built in capital and capital around specifically driving those key deliverables in the strategy. It's a strategy that will help us feed those in line the healthiest, most nutritious food we possibly can at the lowest per meal cost possible, to stretch dollars and close that gap faster. It's also meant to assist those who may be able to leave the line through unprecedented collaboration, communication, and using entrepreneurial solutions that blend the best of corporate supply chain talent and decisions with compassionate nonprofit thinking and a service mentality. This new strategy will do several things: develop a client needs screening and referral process, define the right client-based outcomes, and in fact, let me emphasize that. We now measure everything by what does it do for the clients? What does it not do? No more thinking about success or failure by something inside the Gleaners building, but client-centric outcomes are the key measure in everything now. Leverage our scale. Build on the produce co-op, as you heard me say earlier. Drive down the per meal cost even further. Just in the couple of years I've been at Gleaners, and I'm not saying that claiming credit, just as a time measure, we were at 39 cents a meal. We're now at 24 cents a meal with much, much higher quality, and we're aiming for 13 cents, or 1/3 the cost per meal that we were at just a couple of years ago. And I really think we'll get there. So make our inventory more transparent, a better fit, and more economical to our local pantry partners and others. We need to serve them like the customers and partners that they are. We need to rely on the hub pantries in each county and find one pantry that we can rise up to a leadership role in that local county. And we've already redesigned all the staff roles in that program and service area to get to county level business plans. Fully leverage school distribution. I love the fact that schools are moving back to these neighborhood anchors that they were when I was a kid, and we won't talk about how many years ago, but not just food pantries, but wraparound services that we need to bring into those schools. Unprecedented partnerships but importantly with shared accountability, and further strengthen our own finance team, our finances, our team, our communications. But thankfully, Gleaners is not in this fight alone. We're grateful to partners, and this is a risk always when you start naming a couple of names, but I want to highlight a couple of partners that have recently and specifically stepped up to drive the strategic plan. Corteva AgriScience really jumped behind this produce co-op and the impact on that. Anthem, you've heard. It's not a coincidence that there's an Anthem voice at the table, but there's a lot behind that partnership and driving the client-centric outcomes there. Ortho Indy, great partner in this process. And a non-traditional partner, and I bring this example up because it applies to some others in the room, Nina Mason Pulliam Trust, great partner. I see more opportunity there as well. But they've increased their engagement specifically tied to strategic drivers, not a one-year budget. As you can tell, we need more subject matter expertise if we're going to get these things done. We need all the same volunteer support and resource support that we've needed before, but it's getting complicated to do business as Gleaners. And so if you've ever thought that there's not something you can do to help us, that's not true. We will match your passion, your interest, your enthusiasm to a current or an as yet undiscovered need for Gleaners and our partners. I hope you remain in this site beside the hardworking, dedicated Gleaners team of staff and board and volunteers, and together we can feed all who are hungry, assist those who need a hand up, and move out of the food line into a life where hunger is no longer a barrier to success and happiness. That's our goal. The resources are there. You heard me say it earlier, but I think it just comes down to commitment and creativity. So let me throw a number out. The additional healthcare costs in the state of Indiana attributed to food insecurity are about $1 billion a year. With 20% of that, we could completely solve food insecurity. And when I think about numbers like that, that's why I told you I think it's solvable. But think about that. We only need 20% of that number. Gleaners is prepared to do our part, and frankly do more than our part, because our neighbors are counting on us. I'll close by asking a question. Will you stand with Gleaners? Audience participation is allowed. Thank you.